Larry says, how do you differentiate an SCC from an actinic keratosis, please?
Well, we're going straight on to skin cancer. Okay, well, okay, so you're a perfect candidate here. So we have Stephen here with his somewhat hairless head. So actinic keratoses are minor little crusty bits. They can sometimes form a little horn, but they're made out of keratin. So the keratin is the stuff our hair and nails is made out of. And so you might see a little bit of redness, but you'll tend to see some roughness. And often they're felt rather than seen. So you pass your hand over an older chap's head and you'll feel like sand or glass under the fingers. So we tell people to feel their head, not just look, to feel those actinic keratoses. Sometimes they can produce a little horn and then they're quite obvious. But if you didn't see it when the patient walked in the room, it's not a squame. So squamous cell carcinoma are not subtle at all. We have got some pictures of SCC.
Which ones are those then? Are we talking spiky edges?
19 down here.
Okay, let's try that one out.
So that's an SCC, as you can see, not subtle at all there. This tiny little thing here, so I've got a pointer, haven't I?
Yeah, there you go.
So those little bits are actinic keratosis, little tiny red things. And here, bits of keratin sat on the skin, but with no lumpy base. Tiny bit of scale. This is a great big lump, which is growing week by week. So very, very different. There's another one.
Right. And it would seem difficult for me. It is difficult for me to imagine that a patient would have one of those on the cheek or on the head and not immediately go and say, I need something done about this.
Well, that's why they do present relatively early, because they grow very quickly. So patients, they grow so quickly that this is about as small as they would present, about 1 centimetre, because that will have taken about 6 weeks. So most people will think, oh, I've had a bite, or when it's something I've picked it and it won't heal. So they'll give themselves 3 or 4 weeks at least, and then they'll make an appointment to see the doctor, which might be another 2 or 3 weeks. So we normally see them, and the patients will say, I've had it 2 or 3 months. Yeah. Only patients who've had them before will come in when they're tiny, because they're like, I've had one of these before, it's done. This is exactly how it started. Because everyone thinks, especially as you get older, you get a little blemish, it doesn't. But no, most people don't ignore them. They don't. So it's rare, and it tends to be people in their 80s and 90s with, great big chunky things like that.
Sorry, just going back to that slide, we probably just ought to say that SCC, squamous cell carcinoma.
Squamous cell carcinoma, yes, sorry.
Just to make clear.
I'm terrible, aren't I? Yeah. So squamous cell carcinoma, and it's a cancer of the elderly. You need an awful lot of sun, so you're not going to see an SCC in a 40-year-old. You need someone who works outdoors, or is a farmer or a labourer, who's normally over 50, usually over 70, and who's spent a lifetime of too much sun, and therefore they're not on their thighs, they're on their shoulders, on their face, on the backs of their hands, areas that get sun all the time, tops of their ears, it's like that. Right. So you're not going to miss an SCC, basically. If you're not sure, then it's probably not an SCC.